So 18 years, that's how long I've been sitting across from patients, looking at their eyes and trying to understand what their body and eyes is telling me. And in those 18 years, between thousands of exams from frustrating patients to the ones who genuinely changed the way I think, I've distilled everything down to 3 principles when it comes to eye and visual longevity. So these are the 3 things I tell patients every single day in one way or another. So not because I read them in a textbook, but because I've learned them through pattern recognition, through what's worked, what didn't, and what patients kept coming back for help with because nobody ever had explained to them properly before. If you've ever dealt with dry eyes, irritation, blurry vision, or just feel like your eye's health is falling apart despite doing everything right, stick with me. Because one of these 3 principles is probably the missing piece in your case. So let's get into it. Principle number 1. Take care of your body and your brain and your eyes will follow. Again, take care of your body and your brain and your eyes will follow. This one I genuinely believe is underappreciated even within the field of eye care. Your eyes are not isolated organs. They are a direct extension of your central nervous system. The optic nerve connects your eye directly to your brain, which means the health of your body and the health of your brain are both showing up in your eyes, whether you're aware of it or not. So I want to break this down into 3 categories because I think it will help make connections clearer. So part 1 is physical safety and your eyes. This is the one most people never think about until something goes wrong. And I can understand why. So we don't usually connect a car accident or a sports injury to eye health, but we should. So a traumatic brain injury is one of the most under-recognized causes of vision problems I see in practice. When there is a significant blow to the head, the visual system takes a hit. So we are talking about, double vision, light sensitivity, difficulty tracking, problems with depth perception. So the eye itself may be completely fine, but the brain isn't processing what the eye is sending. And the patients go months, sometimes even years, without anyone connecting their visual symptoms back to a head injury they had. So protect yourself, by wearing seat belts, wearing helmets, whether you're biking, skiing, snowboarding, or on a motorcycle, or on an ATV, your head needs protection. Not just for your brain, but for your vision. Falls are another one, especially as we age. A fall can result in a head impact, can cause retinal detachment, vitreous hemorrhaging, and changes in eye pressure. So taking simple steps like clearing pathways, good lighting, non-slip surfaces matter more than people realize. And in sports, follow the safety rules. I know it sounds obvious, but repeated hits, smaller impacts don't knock you out but accumulate over time and are now understood to cause real neurological damage. And that damage can manifest visually. And the eye is where the brain meets the outside world. So protect the brain and you're protecting the visual system at its root. Part 2 is lifestyle habits that drive eye and brain health. This is the category most of my patients know something about but rarely understand how directly it connects to their eyes. So now we'll go over some lifestyle habits that can impact eye and vision longevity. So first is exercise. So regular physical activity improves blood flow to the brain and to the eye. So the retina is one of the most metabolically active tissue in the human body. It needs oxygen, it needs circulation. Exercise supports that, and there is also emerging research linking regular exercise to reduce risk of glaucoma, reduce risk of age-related macular degeneration, and slower progression of diabetic retinopathy. So make sure to move your body, it's not just for your heart. So second is diet. I always tell patients, eat like your eye health depends on it, because it does. So foods like vegetables, nuts, fish, whole foods. Avoid pro-inflammatory foods such as sugary foods and drinks, refined carbohydrates, processed meats, fried and fast foods, trans and saturated fats, and red meats. So these are all causes inflammation. Instead, eat more of the fatty omega-3 fatty acids, specifically found in fish, flax seeds, walnuts, are among the most well-known studied nutrition for dry eyes. They support the lipid layer of the tear film. Then there is lutein and zeaxanthin found in leafy greens and eggs, which are directly deposited in the macula, the center of your retina, and acts as a protective pigment against light-induced damage. There is also vitamin A found in orange and yellow vegetables is essential for the photoreceptors in your retina to function. So what you eat is the building material for your eyes, so choose accordingly. Third is managing metabolic conditions through weight control. So uncontrolled diabetes is one of the leading causes of blindness in the world. And the damage doesn't start when things severely go out of control. It builds quietly over time through chronically elevated blood sugar and insulin resistance. So diabetic retinopathy, swelling in the macula, changes in the blood vessels at the back of the eye. I see this progression in patients all the time. And in many cases, the eyes show the first signs before other symptoms surface. High blood pressure does the same thing. It damages those tiny little blood vessels in the retina. So manage your pressure, manage your blood sugar, manage your weight. It's all part of eye care. Fourth is sleep. So poor sleep is directly tied to tear film instability. So dry eye symptoms and cognitive performance, which loops back to visual processing. So when you are sleep deprived, your eyes don't recover properly overnight. The nocturnal phase of tear replenishment gets disrupted, and your brain's ability to process visual information gets blunted. So sleep well consistently. Smoking and alcohol. Smoking is a significant risk factor for macular degeneration, one of the leading causes of vision loss in adults over 50. It damages those tiny blood vessels, drives oxidative stress, and accelerates cellular aging in the eye. Alcohol disrupts sleep, drives inflammation, and depletes nutrients that the eye depends on. So these aren't moral judgments, these are clinical realities. So part 3 is mental and social well-being. This is the piece I think surprises most people coming from an eye doctor, but bear with me. Chronic stress is not just a mental health issue, it's a physical one. Cortisol, the primary stress hormone, when chronically elevated, drives symptomatic inflammation. It disrupts your sleep, it suppresses immune function, all of which, as we have established, flows directly to the eyes. Stress-related dry eye is real. Stress-related fluctuation in vision is real. Managing stress through meditation, deep breathing, yoga, whatever works for you is part of managing your ocular health. And social engagement and lifelong learning. So here's something neuroscience community has known for a while. Cognitive reserve, the brain's resilience against decline, is built through use. So staying socially active, learning new skills, challenging your brain. This matters because the visual cortex, the part of the brain that processes what your eyes see, is part of the same system. Brain health and visual function are not separate conversations. So I've had patients with healthy retinas and clear optics who struggle visually because their visual processing has declined. And at the same time, I've seen opposite. Patients with significant eye findings who function remarkably well because their brain compensates so efficiently. The brain and the eye are one system, so invest in both. Here's what I want you to take from this entire principle. When I'm doing a comprehensive eye exam, I'm not just looking at the prescription. I'm asking about your sleep, your stress levels, your exercise habits, your diet, your history of head injuries, your family history of diabetes or cardiovascular disease or neurological conditions. Because all of that is relevant. All of that is information. So your eye exam is one of the few places in medicine where a clinician can look at your blood vessels live without any invasive procedure. So those blood vessels at the back of your eye are a window into your cardiovascular system, into your metabolic health, into your neurological status. So the eye is not just about seeing clearly, it's about understanding your overall health. So take care of your body, protect your brain, manage stress, sleep, movement, nutrition, and connection. And your eyes will tell whether you're succeeding. Now we come to principle number 2. Healthy eyes start with healthy eyelids. So this one genuinely surprises most people when I bring it up. So healthy eyes start with healthy eyelids. Now when I say that, most patients look at me like, what do my eyelids have to do with anything? And I get it. We have been conditioned to think about your eye health in terms of, the eyeball itself, prescriptions, the retina, glaucoma, cataracts. All is valid, all is important, but the eyelid is almost always an afterthought. And that's a massive oversight. And here it's why. So your eyelids are not just the skin and the lashes, they are a complete biological system. And that system is responsible for 4 critical functions that most people have never heard of. So first is tear distribution. Every time you blink, every single blink, your eyelids is spreading a thin layer of tears across your cornea. And that tear film is what keeps your vision clear and your eye surface healthy. If your blink is incomplete, If your eyelids aren't closing all the way, the film breaks down and you get dry spots, blurry vision and irritation. You'd be shocked of how many people have what we call incomplete blink syndrome and have no idea. They think they're blinking properly. They're not fully blinking, and it's slowly wrecking their tear film. But number 2 is oil production. So deep inside your eyelids, both upper and lower, we have these tiny little glands called meibomian glands. So there are roughly around 25 to 30 in each lid. And their entire job is to produce an oil layer of your tear film. So that oil is what prevents the tears from evaporating too fast. When those glands get clogged, and then they do regularly, especially with age, with screen time, with certain skin conditions, and with inflammation, the oil stops flowing and the tear film evaporates. And now we have got evaporative dry eyes, which is actually the most common type of dry eye, and it starts in the eyelid. Number 3 is protection. Your eyelashes aren't just cosmetic. They are sense foreign objects which triggers a blink reflex for protection. So the follicles they grow from are part of the eye's front line defense. And living in those follicles often are totally normal amounts are tiny little mites called demodex. So in small numbers they are harmless. But when they overpopulate, which happens more than people realize, they cause inflammation, they cause irritation, chronic styes, and they compromise the entire lid margin. And the number 4 is microbial balance. Your eyelids has its own microbiome, a community of bacteria that when balanced is actually protective. When that balance tips, from poor hygiene, from contact lens wear, from certain skin conditions like rosacea, things go wrong. Styes, blepharitis, chronic inflammation. So when the patient comes in to see me saying that their eyes are dry, or they keep getting styes, or their vision fluctuates throughout the day, or they just feel like their eyes are off, the first place I look at is the eyelids. Because in a huge number of cases, it's not a complicated eye problem, it's an eyelid problem. And once we treat the lids, the eyes follow. So this is actually a big part of what drove me to develop a home eyelid care solution, because I kept seeing the same pattern over and over. So patients come in with symptoms that had a simple upstream cause that nobody had ever addressed, the eyelid. So if you are dealing with any of those symptoms I mentioned, start thinking about your lids. So we'll talk about more about what to actually do about it in future videos. But for now, just know this. Your eye health starts at the lid margin. So this gets us to principle number 3, which is consistency beats intensity in eye care. Principle number 3, this one hits a little differently because it's not just about eyes. It's really about human beings' approach health in general. So consistency beats intensity every time. And here's what I mean. So when patients come to see me, especially patients with dry eyes or blepharitis or meibomian gland dysfunction, many of them have already tried things, such as hot compresses for weeks, eye drops for a few days. Maybe they've read something online and did a treatment protocol for a while, and then they stopped because they didn't see dramatic results right away. Or life got busy, or they figured, not in pain anymore, I'm probably fine. Sounds familiar? So the thing is, eye health, particularly the health of your tear film and your eyelid glands, responds to daily habits, not periodic interventions. It's not like taking an antibiotic where you do a course and you're done. It's much more like dental hygiene. And I use that analogy on purpose because everyone understands it intuitively. You wouldn't brush your teeth intensely for 2 weeks and then skip next 6 months and expect things to be fine. You brush every day. Twice a day, because the mouth, like the eye, needs consistent maintenance to stay healthy. So the patients I've seen make the most meaningful, lasting improvements in their eye health. They are not doing anything extreme. They are not spending hours on complicated routines. They are just made a few specific parts of their daily life that have stuck with them. So things like blinking properly, and I say properly because most of us, especially those of staring at screens all day, are dramatically under blinking. So we blink maybe half as often in front of the screen as we do otherwise. When we do blink, it's not often complete. If the blink doesn't fully close, the glands don't express fully. So intentional, complete blinking is a skill, and it matters than most people think. So eyelid hygiene. So cleaning your lid margins, keeping the follicles clear, managing the microbial balance we talked about earlier. This doesn't need to be complicated, but it needs to be consistent. A quick daily routine goes infinitely further than an aggressive deep cleanse once a month. So maintaining gland function, warm compresses, lid massages, keeping those meibomian glands expressing properly so the oil stays healthy. Again, daily, not weekly. Not when you remember, but daily. So I want to be real with you here for a second. So the reason I'm talking about this because I've had this conversation more times than I can count. And every time the patient who improves the most is the one who commits to the boring, undramatic daily routine, and not the one who tries the most things. Intensity is seductive because it feels action, but eye health is built quietly, through repetition, through habit. Whatever you choose to do for your eyes, do it every day. That's the whole message of this principle. So these are the three principles. So let me give them to you one more time. So first is take care of your body and your brain, and your eyes will follow. So blood sugar, inflammation, sleep, stress, nutrition, your eyes reflect your health. So listen to them. Second is eyes health starts with your healthy eyelids. So when the eyelids is a system, when it breaks down, the eye suffers. So most dry eyes issues starts at the lid margin. Third is consistency beats intensity. So daily habits, proper blinking, lid hygiene, gland maintenance are worth more than any short-term intense treatment. So build a routine, stick to it. If you found any of this useful, and I hope you did because I genuinely talk about this stuff with patients every single day, please share this with someone who's been dealing with dry eyes or just hasn't thought about their eye health this way before. And if you have questions, drop them in the comments below. I read them, I respond when I can, and a lot of my future video topics come directly from what you asked. I'm Dr. J, your ocular wellness doc, and I'll see you in the next one.